ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರಗಳು. This is Dr. Manjunath Khan. Welcome to my YouTube channel again. Let's learn medicine together and in a very simplest possible way. Today I am discussing two important tables of febrile convulsion from Nelson. These are the risk factors for recurrence of febrile seizure and risk factors for occurrence of subsequent epilepsy. If you master these two tables, you are going to solve most of the MCQ. And if you put this table in your theory exam, you are going to get out marks definitely. So let's learn this table. Risk factor for recurrence of febrile seizure. If anyone asks you what are the chances of my baby getting next febrile convulsion, so you need to know this table for that. So this table has major and minor risk factors. In major we have age less than 1 year, duration of fever less than 24 hours, fever 38 to 39 degrees Celsius. Okay, to make it simple, you can remember all three are less than. Write it like this: less than 1 year, less than 24 hours, and less than 39 degree Celsius. This will make it simple. And what do you mean by duration of fever less than 24 hours? That means the convulsion which is coming within 24 hours of the onset of the fever is a major risk factor. Okay. In minor risk factor we have 1, 2, 3, 4, 5 and 6. In that also 3 are related to the convulsion only. Family history of febrile seizure, in family history of epilepsy, complex febrile seizure in a child, daycare, that means the child managed in a daycare and sent home, male gender, and lower serum sodium at the presentation. And they have not mentioned exactly what is considered as a lower level, like whether it is less than 135 or less than 130, nothing is mentioned, just lower serum sodium at the time of admission. Please remember that if anyone is having no risk factor, the chances of recurrence of febrile seizure is 12%. Remember this line. The examiner will trick you. No risk factor, what are the chances of next febrile seizure? If child is having one risk factor, then 25 to 30%, 50%. If two risk factor, 50 to 59. Three or more risk factor, 79 to 100%. We have another table here, which is a risk of subsequent epilepsy. This is also very important. Don't get confused between the two tables and mark one for other. If child is having simple febrile seizure, 1% risk. If recurrent febrile seizure, then 4% risk. If complex febrile seizure in the form of more than 15 minutes or recurrent within 24 hours, 6%. Remember, recurrent febrile seizure is 4%, but recurrent within 24 hours is 6%, which comes under complex febrile seizure. Fever less than 1 hour before febrile seizure, 11%, 1 for 1. Family history of epilepsy, 18%. In complex febrile seizure, focal, this is the most important data, percentage. Complex febrile seizure, which is focal, which causes 29% of chances of epilepsy. If child is having neurodevelopmental abnormalities, 33%. What do you mean by this line? Having more than one risk factor, at least in part additive. That means if child is having A and B risk factor, it is not like A plus B is equal to C. So it is something is added, but it is not completely additive.